Doctor, my eyes have seen the years and the slow parade of fears without
Hi, welcome back to Accent Your Beauty. I'm Jackie Kallen, co-host with the wonderful, exciting, extraordinary cosmetic surgeon, Dr. Mark Berkowitz, and our guest tonight, Christy Vitale. Doc, tell us what we're talking about tonight.
So today we're going to talk about a very special laser and its capabilities. It's the Picosecond laser. And Christy is the manager. She's also a certified medical laser technician and a cosmetologist. And we use this laser at Invisible Ink at my office to take away tattoos.
So when you say invisible ink, is it actually an ink that goes under the skin and removes the ink that's already there?
No, it's actually laser tattoo removal. It's Pico technology, so it just removes the tattoo over a certain amount of treatments. I would say on average it takes about anywhere between 6 and 10 treatments for a complete removal.
So it's pretty amazing because this technology, Pico, is 1 to the minus 10th of a second. So it's something that's very fast, and I'll show you a little bit about the technology. Could we have the next slide? So this is the laser, and the laser can do tattoo removal. It also helps with wrinkles that we'll talk about later, acne scars, and those brown spots on the skin too. And so
Age spots?
those age spots.
Yeah.
And it does it for the face with no downtime. And as Christy said before, with tattoo removal, there's multiple treatments and there could be a little bit of downtime. Can we have the next slide? So this shows for tattoo removal, you can see this is just with 2 treatments how the laser brings down the tattoos. And we're going to show some even more exciting ones. But this spot is called a cafe au lait spot, very difficult to treat on the skin. And this is just 1 treatment, and you can see the lightening that this does. So it's pretty amazing.
Now, does it work on all skin types? Like when you see tattoos on darker skin people, you wouldn't want it to be whited out where now the skin there is a lighter color. So does it remove it without removing any of the, the melanin in the skin?
Yes, we actually use the 1064 laser, which actually bypasses the color of the skin and goes straight for the ink. So it just doesn't leave any risk to the surrounding tissue.
Yeah, this is one of the first lasers that can be used on darker skin types and will not harm the surrounding skin because it has more than 1 laser in it, and so we can look at different colors and treat those different colors in the tattoo itself and different color skin as well.
Because that's important. A lot of the darker skinned people that have tattoos, I would think it's a little harder, especially the ones that are purely black, not the colored ones. Which are harder for you to remove, a black tattoo or a multicolored tattoo?
We are actually broad spectrum removal, so we absorb all sorts of colors. We have a 532 laser that absorbs the red, yellows, oranges, and fire colors, a 785 that treats the blues, the greens, and the purples, and a 1064 that lightens up all colors but mainly treats the blacks and the browns. So all colors are really equally easy for us to remove.
So I think we have a video showing a treatment. So Christy, tell us a little bit about what's the patient's feeling, what's happening.
So it feels, I would say, like warm rubber band snaps. We work off of energy and pressure and only 15% heat versus the older technology that actually uses 50 to 100% heat. So the pain levels are much different than the older technology.
Look how fast that's going away.
And that's frosting.
You can remove one in one treatment?
We can remove, we call them stick and pokes, something that somebody just did in their basement. We can do those in 1 to 3 sessions. What you're seeing right now is frosting, and that's the gases being released into the air, and then the ink breaking up, and then that automatically goes away within just a few minutes.
So there's different kinds of tattoos, obviously. There's people who do it themselves, like you said, right? And what about prison tattoos, where they do those themselves? Are those easier because they're not in as deep as the professional ones?
Absolutely. We actually have a couple of patients that have prison tattoos, and we see them remove anywhere between 1 and 3 treatments for something like that.
What's the cost? I mean, you say somebody that just got out of prison wants to remove their tats, especially the ones that have the teardrops and the things on their face. that represent what gangs they were in. They want to get a job and they want all that removed. How do they afford that? Is it covered by insurance or is this purely cosmetic?
It's purely cosmetic. I would say, you know, there's so many different factors that go into pricing. The size of the tattoo, the age, the density, the location. Typically, we do things per package with our company because we offer a guarantee. So that guarantee offers a full removal process. So if we don't remove it in the time that we tell you, then we're going to keep treating you at no additional cost until the ink's removed. We do pay per session, but that doesn't offer any discounts or guarantees. So I feel like most people go with the package.
Well, it makes sense, right, Doc,
It
to
does.
get the package.
And the beauty of Invisible Ink is that we have a database of so many different tattoos and skin types that we really know down to that session how many sessions it will need for them. I mean, even to the point somebody comes in with a tattoo of a dolphin on their arm, we can probably show them somebody else that had a dolphin and what their tattoo looked like afterwards.
Yeah, that's called Ink Analytics, and Ink Analytics was just developed through doctors and plastic surgeons, and really, what it really does is it bases their information, their specific information about their tattoo, and bases it off of the 38,000 treatments we've done as a company, and it comes up with the treatment number, and then we just stick by that number.
So you can also do partial removal. Let's say somebody has a big heart and the name of the person they were going with. Now they broke up, they want to keep the heart, but they want the name gone. You can do as much as just a small amount or the whole entire back of someone, correct?
Absolutely. Energy does spread, so it's not super precise. But you know, it just lightens up a little bit of the boundaries beside it, and then they can just touch it up at the end. But yeah, we can do that.
You know, they have some on their arm, I love Marge, and now it's, you know, Margaret. And
Right. Well, yeah, some of them you can
Right.
just kind of fix without removing the whole thing.
Absolutely.
On a scale of 1 to 10, 10 being how much a tattoo probably hurts. I've never had one, but everyone says they hurt. Is the removal of it less painful than the actual tattoo process?
I hear different feedback from different patients. Some people are really tolerable. We do offer numbing, which is a 5% lidocaine treatment, and we do offer cryotechnology, which is a Zimmer, and that just cools down your skin during the treatment, so your body can't desensitize the two sensations
It's
at
like
once.
an air conditioner focused directly on your skin to cool it at the same
Well, that's
time.
great. So obviously it's not unbearable because people do it, just like tattoos. You know, as much as people complain that they hurt, they get addicted and they go back. So with this process, if they're tired of a particular tattoo or it has meaning that they don't want to have anymore, they can remove it, and then can they re-tattoo that area after you have removed it?
Absolutely. We work directly with a lot of tattoo shops in the area, and we lighten up a lot of tattoos for them so they can actually do tattoos over, because we don't damage the skin, so it allows them to have great work after we're done.
We actually have some slides on how the Pico Way works, but we also, and a video of before and afters. But this basically shows where we're going down to on the skin, but it does not affect that top layer of the skin, and that's what makes it faster healing. Let's go to the next slide. So this is a piece of lucite, and what this is showing is that using the laser, you can kind of see a little shadow inside of the lucite.
Correct.
But the top of the lucite's not even touched. This is amazing technology. So it goes below that top level of skin and goes underneath to do the work it needs to do. Next slide, please. And this is just showing the laser working and then how it rebuilds the collagen 2 months later. So that's more for the skin resurfacing. So it just builds whole new collagen and can create youth for you. Next
2
slide.
months later, and you have
2 months
complete
later.
healing.
Yeah. So this is pretty amazing. This one laser can be used for wrinkles, and look at the numbers of improvement: 82 to 92% acne scars,
Wow.
94% benign lesions, those browns, 96% and tattoo removal in the high 80s. So it's fairly amazing. Let's go to the next slide, please. And again, just showing tattoo right afterwards, right after one treatment and right after 3. Next slide, please, or the video. So of tattoo removals.
That's amazing right there.
You know, no longer likes Thomas, so.
Yeah, right?
And that unicorn just didn't fly.
Okay.
Some kind of flower.
Well, we change. You know, what
And
we
these
like,
are-
we change.
So these are in progress, so you can see the changes are made. You asked about dark
Yeah,
skin.
they're, uh-huh.
And these, a lot of these colors were not able to be changed 2 years ago. And with this new technology, we can, eradicate it, and for the most part, 85% plus, and sometimes up to 100% depending upon the colors.
Now we're talking about tattoos, but what about other like brown spots on your back, or people that have a lot of freckles, let's say, on their back?
So this,
Can you lessen that?
you can with the same technology, and we'll show pictures in the next segment of that, and actually a surprise guest that had it done as well.
Okay.
So that's going to be great. So as far as the patients that you see, what colors do you think are the easiest to treat of all of them?
Well, black will always be the easiest. A lot of shading is more superficial in the top layers of the skin, so that makes it easier. The next, I would say, red is really easy. Oranges and the fire colors. The 532 is pretty aggressive, and the 785 it absorbs the greens and the purples, and it does a really good job.
What do you think, the most difficult tattoo or color?
I would say yellow, yellow and white, because it's so close to pigment colors, and the machine really just doesn't like to recognize those colors. So we actually wait for them to turn a brown color, and then we start treating them on separate wavelengths to actually fully remove them.
I'm curious, what's the largest tattoo you personally? Have you ever done a full back?
We are
or
doing
a whole sleeve?
Yes, we do a lot of big pieces in Detroit. They tell us that Detroit's the tattoo nation. So we do. We've done some backs. We have a girl with a full tree on her back. She's getting married, and she has a backless dress. So hers will be a full removal. We do lots of full sleeves. So we do a lot of large pieces.
If you're getting married, don't come to us a week beforehand.
I
know,
gonna
right?
say, you better plan that one a
Yeah.
year ahead to have all those different processes, especially if it's your full back in color. How many treatments would you say that would take?
I would say for hers, it's anywhere between 8 and 11 treatments. It goes
And
by
how
the
are they spaced? A month apart, a week apart?
We do treatments depending on the skin color, because we like to let the melanin heal. So I would say, anywhere between a skin type 1 through 3, which is, a lighter skin tone, we book out every 8 weeks in between the treatments. And then 10 and 12 for a little bit darker skin
So she
tones.
better plan it 2 years ahead, I think.
It is
to
about-
make sure it's completely removed.
Yeah, it's about a 1.5 to 2 year process.
But well worth it if you want that smooth back in your backless dress.
Absolutely.
Are there people who can't have laser tattoo removal?
There are some contraindications because once we shatter that ink, it filters through the body. Anybody with like a low immune system or autoimmune disorder sometimes can be a contraindication. Keloid scarring, just in case, because we don't want to damage the skin or anything like that. But there's not too many risks to the procedure, with the newer technology. So.
And how long, I was just curious, how long is a typical session? Like how long is the person laying there with you removing it?
Well, I would say I timed my technician from here to here, and it was about 1 minute and 45 seconds. Our pulse duration is really quick. It's a trillionth of a second. So that really allows...
Trillionth?
A trillionth of a second, yes.
I'd like to know who figured that one out.
Some very bright scientists.
Yeah,
Right.
trillionth, wow.
The lasers before it were 10 to the minus 9th, and so this is even further than that. It's pretty amazing.
What I meant was how long is a session? Like if I come into your office and say I want a tattoo of a bird removed, how long do I sit there? If it's going to take 3-4 sessions, how long each session?
1 minute and 45 seconds.
That's it?
Yes, depending on the size. Sometimes Jennifer gets them done in 30 seconds or less.
Oh my gosh, I'm surprised. I was expecting that it was going to take longer than that. So it's just that short a time, 7, 8, 9 times. Wow, that's pretty great.
I usually tell people if you can sit there for 4 hours and get a tattoo, you can spend the 30 seconds to a minute to get it off.
Absolutely.
What kind of aftercare do?
We have a really good aftercare regimen that really sets us apart from a lot of places in the area. Most places just send you home, don't even tape you up. We actually use something called trisimilone cream, which is just an antibiotic, kind of like a steroid cream, and it just really helps with the inflammation, the redness, any petechia or purpura that you do get during the treatment and after the treatment. That's just kind of the redness that you're going to get from bringing the blood and the ink to the surface of the skin.
And how long does that last? The redness and does it get a little bit puffy? Does it swell up a teeny bit?
Yeah, about 24 to 72 hours. I
that's not
usually
bad.
say that it will subside due to the aftercare. We like you to keep it covered for 24 hours. We like you to keep it out of the sun for 2 weeks prior and 2 weeks after the treatment, just to keep the skin from getting pigmentation changes.
And that's important with any treatment, is staying out of the sun.
I'm sure. The sun certainly is our enemy in a lot of ways. It feels good, but doesn't always do great things to your skin.
Absolutely.
So as far as the laser is concerned, so we've had the laser now for a year and a half. And so before that technology, a lot of times people would come in and certain colors wouldn't be able to be treated at all, and certain skin types. And so this laser was brought into the Detroit area to help the darker skin types. And not everybody throughout the country has the ability to offer this laser.
That's why I asked that, because I know people that have been in gangs, and at the time they thought it was really great and they were proud to show it. Now they're a little older, they want to get out into the workforce, and they want those gone because no one's going to hire them with this tattoo on their neck. So I think that you probably have a lot of clients that want your service. Is it expensive?
It really, depends on the size of the tattoo. Average treatment can be anywhere between $150 on up to, I would say, $900, but that's a full back.
Right. So for $150 once every 6 to 8 weeks, that's affordable. And especially if you're investing in yourself to be a good candidate for a job, I think it's wonderful. And I think we're really lucky that this new procedures available.
Absolutely, and we do have really good payment plans also available to everybody that are as low as $120 a month.
Well, this is all great. It's exciting. When we come back, we're going to talk a little bit more about your wonderful machine and what else it does. We'll be right back.
Want to stay informed, entertained, and enlightened? Get connected and stay connected today to New Radio Media. The New Radio Media app is now available for download in the Apple and Google Play Store. Just search for NRM Streams for unlimited access to archived, live, new, exciting, and unique content,
Welcome to Geektainment Weekly.
all for free. Do it now. Stay connected.
And action.
And millions of ducks. The two guys go to newradiomedia.com.
The Arts and Entertainment Channel on New Radio Media .com.
What's going on in your neighborhood?
They say it takes a village.
It's the simple things.
The things that are a testament to the old.
And the things that are a testament to the new.
Know what's going on in your community.
Check out our community channel on newradiomedia.com.
It's all about you, and that's the way we like it.
Where you're going.
What you do to stay fit.
What you're eating.
What you're thinking?
And how you're feeling. Join the conversation at newradiomedia.com's Lifestyles channel.
Stream the life you want to live.
Doctor, my eyes
Let's talk about some other ways that this fabulous, wonderful new machine, things that it can do besides tattoo removal. Tell us some other good uses of this.
This machine is great for use on the face as well, to help rejuvenate and get rid of some of the wrinkles that are there, to help with brown spotting that's there too. Can also be used on the hands for brown spotting as well. And I think we have a slide or a video first. Let's take a look. So this
How's
guy,
it feel, Doc?
you may know.
Looks like somebody
It looks brilliant. So I'm having this done myself. I love this.
It's not bad at all.
You love it, like it feels good.
We don't have you
love it.
numbed or anything
It doesn't
right now.
because of what it does, and it doesn't hurt. I have no numbing cream, no injections. Didn't
And
take any
what was on
medication.
your forehead that you needed to do that?
So I want to build collagen. So the whole idea is to build fresh collagen, and so it gives a more youthful look. You know, I'm 98 years old.
Oh, I see. That's how great this process is. Let me ask you a question about that. Is it a replacement for Botox?
So it's not a replacement for Botox. So Botox will help to stop muscles from squeezing, and by doing that will give a natural look to the skin and not at all make you look paralyzed or plastic, but it doesn't build collagen. And part of the reason we look older as we mature is because of this loss of elastin in the skin and loss of collagen. So if we can build up collagen, we look more youthful.
So you can do both though, right? You can do Botox and that, right?
You can do those two. You can do other things along with it too, and we'll talk about some of those other things. Can we have the next slide? So what this is showing is a person immediately post the procedure, the little bit of redness that they have. Then 24 hours post-procedure, you see the redness is already going away, and 24 hours later, she can already wear makeup. So that's compared to a lot of the other resurfacing procedures that are out there. Remember, this does not harm the top layer of the skin.
What did she have done? What was her problem?
So this was a problem, again, she wants to build collagen because of wrinkles and some of the brown spotting as well. And so we want to decrease that. And this is something that you could do once a month. It only takes 10 or 15 minutes
So you can
time.
do it with a facial or something else that you have.
You could. We combine it a lot with a special facial called a hydrofacial at our office.
Oh, I'm loving this.
So a hydrofacial is beautiful because of the fact that it basically will not only, I call it the Rolls Royce of facials.
Okay.
Because it not only removes debris, but it infuses into the skin from peels into the skin to help peel and turn over the skin, to if you need to get rid of brown spots, we can customize different chemicals within the skin, cosmeceuticals, to improve your skin.
Well, I think it's very important that people know the difference between just washing your face at home and getting one of those deep facials that gets off all the junk and the crap that gets in your pores from repeated foundation use, blush, all the different things that actually go into the skin and flake on the top layer.
What we'll do is, in an upcoming episode, we'll do a hydrofacial, and at the end, some people love to see it, others don't. At the end, you can see within the collection jar how it was clear beforehand and all of the debris that's removed from the skin.
Oh, I love that. See, I'd be the first one to say, let me see it. I want to know what was on my face that's no longer on my face.
Let's take a look at the next slide. So this is, again, used to decrease wrinkle appearance. This is only 6 weeks later between the two slides and only 2 treatments, and you can see the improvement in the skin type. And
That's
this
great.
procedure with the Pico Wave laser we call Resolve. And let's go to the next. And look at the beautiful changes here. Again, for facial wrinkles, no downtime. This is before, this is 12 weeks later. You can see the improvement in the skin,
Especially
the tightening
right
of the
there
skin.
in that area with the Mariette lines and that
Yep.
whole area.
And that's why we take pictures like this, so the person's face is in the exact same plane, and so you can see those changes. It's quite dramatic. Let's go to the next slide. This is the acne scarring. So acne scarring we treat with multiple modalities. So you can see the amount of scarring in the first picture, and this is 3 treatments later. I like for acne scarring to treat it with multiple types of treatments. My feeling is 1 + 1 + 1 doesn't equal 3. It can equal 9 or 10 in regard to the changes. So I like starting with a procedure like the Resolve laser, or something like skin resurfacing using a fractional CO2 laser to start building up collagen. And then I like the vampire facial.
I was going to ask about that, putting those platelets back
So
in.
those platelets, but it's more than platelets. What it is the platelets actually have growth factors within them. And the growth factors will help to build collagen, but they start this natural cascade to heal. And so it tells all the other cells which ones to come into the place of the scarring to build up collagen. It's really that the body can heal itself with this little push from your own body, because it's your own blood that we're using in that vampire facial. And so, I mean, this is exciting because, you know, so many people are affected by acne scars, and, you know, to the point that they hide. They don't want to come out.
It's embarrassing.
And so the other thing that can be used is there's a filler called Bellafill.
Just going to ask you about that, because some of the acne scars are pretty deep, and just resurfacing isn't going to get the real deep ones. So you can fill those pock marks.
The beauty of Bellafill is that Bellafill #1 is the first filler to be FDA approved for acne scars. Second, it's the first one that went to the FDA and wasn't scared of the FDA and said to them, you know what, every other filler you've looked at for a year, we want you to look at us for 5 years. They looked at them for 5 years, and they found out not only did it last, but the side effect profile was safer than the other fillers that are out there. So you've got a safe filler that can be used directly for acne scars. And so when you combine it with things like Resolve, with the vampire facial, it's really life-changing for these patients, these clients that we have. So they go from, you know, many of them quiet to just outgoing once they, you know, can change that on their skin.
Now, is the needle for that a very thin one to go inside those little pock marks? Or
So the needle that's used is actually very small in itself, and many of these people have lost collagen underneath the scarring. So the scarring, there's basically a pull within that area. So what I'll do is use something called subcision. So what subcision is I break down the scar tissue underneath the skin, and then I'll put filler with a cannula. So a cannula is not sharp at all. And using the cannula, I'll spread the filler within the cheek to build up their lost volume. So I'm not just treating that individual scar alone with the small needle, but I'm treating the entire area for them and building up collagen for them. So it's quite remarkable.
let me ask you about the back, because a lot of people that have had acne get it on their back, and they're afraid to go to the beach. They don't want to take their shirt off because their back is so bad. Is this effective on the back as well?
So this can be used on the back as well, this treatment on their skin. And we can actually show some pictures. I'm not sure if we have back pictures, but I'll show you some before and after pictures of the treatment. So this is before. Let's go to the next picture.
That's the wrinkle.
Yeah.
And that looks wonderful. Oh, look at that. Okay.
You can see that scar.
Now, do you remove the redness as well?
So the redness will improve too at the same time. We can treat the reds and the browns. Let's go to the next picture. So you can see this right afterwards. This picture being close up, you can really see that change that we made. Let's go to the next picture. And again, acne scarring. Look at the difference between those two.
Wow,
It's
especially
remarkable.
on the deep ones. The redder ones, they're so much smoother.
Next
you must have had a very happy person that walked out there.
Very happy. And then you look over here and you look at these red marks and how they're decreased after 3 treatments. Next picture. And we're looking at the brown spot over the lip and how that's lightened dramatically after, and the scar that's there. Let's go to the next. And again, looking at the wrinkles, and this is just one treatment. Let's go next. Look how beautiful.
That's dramatic.
Okay,
Wow.
and beforehand, this is something you can only treat with downtime. And this person has no downtime. They did have 5 treatments, but again, there's no downtime after the treatments. And you can see.
Oh, it's amazing. Look at the difference there. In the cheek area, around the mouth, beautiful.
Do we have another slide? This is different view.
Wow.
Next picture. And again, look, so you can see what somebody looks like immediately post-op. It's not like the CO2 laser, where they're extremely red and can be slightly uncomfortable. here there's redness, but that redness goes away fast. And here's 6 weeks after 2 treatments, and you can see that major change for them.
So the redness, would you say 24, 48
24
hours?
Yeah, 24 at most. And most people don't even leave with redness.
Wow. Isn't it amazing what can be done? There's no excuse to walk around with wrinkles and acne scars when there's something so wonderful.
And do we have any other pictures of that? Oh, beautiful. So again, look at the browns on the skin. Look at the lines that are there too. And the picture is taken again so that the patient's face is in the same position as well. See?
Look how alive and youthful and bright it is afterwards. It's like baby skin again.
Next picture, please.
Wow.
And do we have one more? There we go.
Beautiful.
Beautiful changes.
I have a question
Go ahead.
about the hands, because as we get older, we get those age spots, and for some reason they find their way to people's hands. Why is that an area that, is it because it's in the sun all the time?
It's in the sun. It's in the sun. And it's interesting, a lot of times when you put on sunblock, people put on sunblock and they use their palms, and they never then go over the top of their hands.
That's the first sign of a lady's age. One of the first signs is their hands.
But we can change that.
So yeah, you want those smooth hands. Now, obviously, the age spots are from sun, but what's a liver spot? How would you describe that? Is it the same thing?
It can be from sun damage too, but it can also be genetic as well, some of the spots that we get too, and so it really needs to be looked at, and it needs to be looked closely because at times it can even be a skin cancer within the area.
And how do you detect that? I know they say there's ABCs, right? The asymmetry,
Yeah.
the borders, and the color. Is that correct?
That's correct. So we look at those things, and sometimes we can't tell until we do a biopsy. And once a biopsy is performed, then under the microscope, we see the certain cells, and from those cells, we can tell exactly what it is. But any spot that you're not sure of should be thought of as a skin cancer anywhere on the body until a physician takes a look at it, and either by looking at it or taking a biopsy tells you for sure.
That's good news, especially in the summer. Everybody's out in the sun. When we come back, we've got some more good things to talk about, and we're going to make you so beautiful that your friends won't even recognize you. We'll be right back.
Tarno knows doors. We've got garage doors, entry doors, storm doors, custom doors. Tarno knows doors.
Plus, the latest LiftMaster garage door openers and the toughest retractable screens on the market, all by the push of a button. Tarno Doors is celebrating its 50th year anniversary and is the recipient of the 2016 Subcontractor of the Year from the Home Builders Association.
Tarno knows doors. Tarno knows doors.
Advertising your business these days can be challenging. Traditional radio and TV ads are expensive and, frankly, a bit of a crapshoot. Not to mention, the audience for over-the-air material is shrinking as more and more of us demand to see and hear what we want, when we want. Advertising on new radio media is a solution. With our live streaming programs that are also available on demand, your message is always ready when your customers are ready to watch and listen, all for a fraction of what you'd likely have been paying for other ads. NewRadioMedia.com. Call Buzz Van Houten at 248-939-9999 for more information.
Hey, you guys, it's Raphael of the Teenage Mutant Ninja Turtles. Guess what? The only thing we can get down here in the sewer is Geektainment Weekly on New Radio Media. Turtle Power!
Maple Lane Golf Club is a 54-hole golfing treasure located in the heart of Sterling Heights. Maple Lane Golf Club offers immaculate greens, a top-flight pro shop, and inexpensive green fees. For convenience, book your tee time online at maplelanegolf.com. Come out and enjoy a great golf experience. Try our 9 and Dine special, 9 holes of golf, and enjoy food and refreshments in the Clubhouse Bistro. That's Maple Lane Golf Club in Sterling Heights. Check us out at maplelanegolf.com.
Now we want to welcome the beautiful Megan Valenti, and she's got some products, and I'm a junkie for skin products, so I'll probably be your first customer for tonight, but let's hear.
So I do have few different lines that I love that Dr. Berkowitz has brought in. Definage is something new that we're bringing in, incorporating into our skincare lines. This, for me, when I start to use this product, is going to be more for skin sun damage type of. I do have some sun damage, so I think this would be the perfect product for me to kind of help diminish those spots as well. There are definitely other uses that are even better for the sun damage fixing, and Dr. Berkowitz.
So this product line came out recently within the past year. I've actually been using it morning and night for the past 2 months, and it is pretty amazing. Can we bring up the slides on Definage? So this line has 3 main products that we have here, and we'll talk about. But what's amazing about it is what they say there is true. And we'll talk about all 16 signs of aging that you can reverse in 6 weeks. This
sounds too good to be
true.
true.
Right. It sounds like an infomercial.
That's why I'm excited.
Yeah, I'm
reverse the sun damage.
Real attention here. Let's go.
Let's go to the next slide. So you may have heard of stem cells.
Of course.
Okay. So what many people don't know is stem cells are in places besides bone marrow. Number one, it's in your own body fat, and we'll talk in the future about how we can use your own body fat to rejuvenate your face.
Oh, and most of us
your
have
hair,
a little to spare.
Right?
Good.
And
yeah.
so it's funny because so many people, they hear that and they're saying, wow, this is great. I can rejuvenate, but it just like you said, but they've got some to spare, so take as much as you can.
Exactly, but you don't really need that much.
Right.
It's not exactly like cool sculpting or anything like that.
That's
but we'll
correct.
hear more about that.
It's just a few. But what this does is there are special proteins that have been found called defensins. And the defensins will stimulate your own stem cells. So to start that rejuvenation process and cascade. Not only that, it can actually help with trauma. And I'm going to show you later how these products can be used not just to heal the skin, but if there's trauma to the skin, it helps in healing that as well. Let's go to the next slide. So these stem cells, you may notice from the past, that's the hair follicle that we spoke about. Well, part of the hair follicle has something called LGR6. And so not to get too technical, but basically what we do is we turn on these master stem cells that are on the hair follicle for skin repair. And this product line turns that on. It's the first one of its kind.
You mean the little baby fine hairs that we have?
Those little hairs, it finds that bulb, it turns on that skin repair cycle.
Wow, okay.
Let's go to the next slide. So if you look up to the top, you'll see somebody that has a skin wound.
Yeah, that looks yucky.
It looks yucky. But if you look at day 0 and day 10 on the one side versus day 0 and day 10 on the other side, you'll notice that one of them, it's fully healed. And it's healed because this product was placed over that 10-day period, while on the control did not have that same product used.
Wow,
but
that's a very big difference in the after look of the
So
wound.
think if it can heal this wound, what it can do for your face. The other thing that it's found is the more damage you have, the faster you'll see the changes with this product line.
Wow.
That's why I'm excited to try it.
Yeah.
I'm really excited to get it going.
Before we show the next slide, those are just sample sizes.
So these
That's
are
not the actual size.
That's correct. And so these we call our airplane bag.
Okay.
Okay,
Fly
so
kit.
this is the fly kit. And so what we do is actually for any of the viewers, when they purchase a full size of the 3, we give them the fly kit too, so that they can take it with them.
Oh, that's great. For those of us that travel a lot and you can't take a carry-on with the big bottles, so that's awesome. Right. Do you want to talk cost, or let's watch?
We can
some
talk
more
cost.
slides?
So
I'm just curious: are those 3 samples of the same product?
No, there's 3 different products that
Okay.
are here, and so this, these sample sizes, the fly kit, they'll last approximately 2 weeks. The full sizes, people can get up to 2 months plus with, in regard to the product.
Good.
All 3 products are priced at $285. Okay, and then the fly kit, I believe offhand is $45, but we give them that complimentary, through the show.
So when you break it down, it's pennies a day. I mean, it's not a lot for the results that you can expect to get.
It's pretty amazing. So
And 6 weeks goes fast before you know it.
Right.
So there's 3 steps. So the first step is this 2-minute reveal. And this is an exfoliation. This only needs to be done twice per week. And so what you do is you wash your face, and when it's still wet, you place on a mask. You let the mask sit only for 2 minutes.
So that's the mask in there?
This is the mask.
You put it on for 2 minutes, wash it off.
And then you actually, as you're washing it off, you massage it in, and then
Can
it washes
you use
off.
one of those little brushes?
There's no reason.
Okay, you don't need to.
You can feel this because you'll see it has the exfoliants in it. I've got to take off the safety seal first. But we'll get that off while I'm talking about the next product. So
Because I'm just curious how important it is that you use all 3. In other words, you don't want to buy just the one without preparing the skin first. And
it's
then
actually important for the majority of people to use all 3, but not everybody. So just put a little bit on, and you'll feel that little bit of grittiness.
Okay.
And that's the exfoliant that's in it. So you don't need one
right.
of those.
It reminds me of the apricot scrub
Right.
that I used to get that
So
had the little particles
You
in
don't
it.
need anything but your fingers to
Oh, yeah.
massage it in.
Nice.
And then what I was saying with this is people who are acne prone, I don't have them use this because the exfoliant can actually cause the acne to come out. So
to make it flare up a little
so-
bit, if
so
those
this-
little particles get into the holes.
can happen. And so
Okay.
that is a person I would not have use this part.
Okay.
Then the second 2, you use morning and night. So the second 2, number 1 is a barrier cream that you put on. You put the barrier cream, and you don't need much of it. So, again, we've got the safety seal.
That's okay, but the point being is that one is for morning and one is for night?
No, they're both morning,
for
both morning and
they're
night.
both night.
So you put
So those 2 are basically the same.
Well, this one's first a barrier cream, and what it does is it makes it that, number 1, stop pollutants from getting onto the skin.
So it's like a seal. It
And it's a
helps
seal. It is a seal.
Okay.
To the point that we have to make sure that if you're using other products, we have to go through with you which ones to use before and which ones to use after, because this will seal the skin.
Now, can you put makeup over it once it dries?
You certainly can.
Okay.
Now, unlike other products where you have to wait 5-10 minutes, this product, this is the key product, the serum, you only have to wait 30 seconds after you apply that.
And
to
then
put
you do the serum.
And then you do the serum.
Now, does it penetrate even though that's a seal?
Because these 2 work together.
Okay.
So this one helps it to spread, but then anything else you're going to put on the skin is not going to get down into the skin. So that's why we have you put something like sunblock on afterwards.
You can feel that there's like a seal right there. It feels good, actually.
And then you could try this one.
Oh, no, that's silky.
Yeah,
It feels nice and smooth and silky. Well, you can see what that would do to your face if this is what it does to your hand.
So I want you to try this because you're going to see, if you use it tonight, tomorrow you're already going to say there's something different about your skin. I'm telling you. I'm telling you. Tomorrow.
Wait till next week or the week after show. You'll see the difference. I'll be so much younger looking. Okay.
Let's go to the next slide. So again, this is showing those new stem cells coming up and causing the new keratinocytes. So that's the new skin cells.
The word retinol there is important.
Right. So retinol is vitamin A. And so you can still use a retinol along with definage because they work in 2 different ways. The whole thing here is retinol stimulates old stem cells. Okay. While the defensins, definage, is the first one to cause new stem cells. So the old ones, well, they've been there for some time. You want something fresh to liven up the skin, and that's why this makes such a difference. But they can be used together. Some people don't want to get rid of their retin A. They don't have to. They can use them combined.
Now, retinol sometimes can have a drying effect, and this seems like it has a much smoother, and the serum feels so good. So you could actually discontinue your retin A and go strictly to this if you want to, correct?
You can, and then if your retin A is drying out your skin, then you're either using it too much or the wrong one. So there are other products, not this one, that have retin A in them that are emollient. And so we have them at Accents, and we can put you into the correct one to
Okay,
use.
good.
Let's go to the next slide. So this is the 3 products. And again, just as I said before, this is groundbreaking. It's a paradigm shift. It is a change unlike any other in the skincare market. And let's go to the next slide. So these are the 16 different signs that change. It gives a new firmness to the skin. It brightens the age spots. It helps with contouring of the skin. It smooths lines. It diminishes wrinkles. Pore size changes. If you have a sensitivity, it helps with that. It evens out the skin tone. It corrects surface imperfections. It revives clarity of the skin. It replenishes the moisture. It repairs the dryness. It refines the texture. It gives new softness, gets rid of the dullness, and calms redness.
Oh my gosh,
Okay.
that does absolutely everything you'd want to have done to your skin. Now, this product, is it not available only at doctor's offices?
Only at doctor's
so
offices.
So it's not at department stores or drug stores?
No.
It's a medical product that's
Correct.
sold through your doctor.
Correct. It is an amazing product line. And as I said,
How
so I've been
exciting.
using it for 2 months. I'm seeing changes. And the people who have started with it at my office, they love it. And they're seeing changes, within usually a few weeks' time.
I think I need to be a rep for this and go out and sell it to all my friends because we all want all those 16 things that you just mentioned. So hopefully we'll all have a chance to purchase this, and maybe on a future show we'll have some specials where people can call in and order the product from us, get the free travel kit, and they too can see the difference in their skin right away. We'll be back, and we've got another surprise for you coming up.
If you need a fingerprinting service, A1 Fingerprints is the place to go. A1 Fingerprints specializes in fingerprinting for teachers, students, law enforcement, and more. A1 makes the process so easy and simple you can be in and out in 10 minutes. A1 does walk-ins so appointments aren't necessary. A1 Fingerprints, located in Southfield on Southfield Road. Go to a1fingerprints.com for more information. That's a1fingerprints.com. It's that easy.
Surfing the internet can be good for your brain, especially if you're getting up there in years. UCLA scientists say that the internet searching helps to stimulate your brain function by triggering centers in your brain that control decision-making and complex reasoning. In a study to be published in the American Journal of Geriatric Psychiatry, the researchers say that using the internet to seek out new information might stimulate the brain enough to sustain brain health and your cognitive ability. Before the computer age, the one activity that was linked to an active mind was solving crossword puzzles. The fact that even simple tasks like searching the internet might enhance your brain circuitry suggests that our brains are really sensitive to mental exercise and actually continue to learn as we grow older. So using an internet search engine such as Google produces the same brain activities as reading, but it also increases activity in areas of your brain that control decision making and complex reasoning. With another prescription for your health, I'm Dr. Jim Bragman.
Hi, I'm Art, and we're the crew at Tuffy Walled Lake. We've been in Walled Lake for 20 years, and through our knowledgeable staff and customer satisfaction, we've become quite the cornerstone in our community and to our discerning customers statewide. We know how important your vehicle is to you, and we take pride in our impeccable, affordable service, and we're trying to get you back on the road as quickly and safely as we possibly can. Please stop in and see why everybody comes from all over to get their cars serviced at 784 North Pontiac Trail in Walled Lake.
This is going to be a really fun segment. Josh is with us, and he's kind of we're calling him our celebrity, consultant, celebrity correspondent.
Sounds good to me.
You're a celebrity correspondent.
Besides that, tell us what you really do.
So I work for Dr. Berkowitz. I'm his medical esthetician at Accents. We work a lot with patients as far as skincare goes, trying to just really help them achieve their overall desires, whether that's with fine lines and wrinkles, whether that's just improving, some signs of aging, whatever it is. So we do facials, chemical peels.
Well, whatever treatment you get, it helps to start out with a really nice, good facial, right?
Absolutely.
Just to clean the skin, exfoliate it. Then the products are absorbed better when your skin is cleaner, correct?
Correct.
So what are we talking about tonight?
So tonight, I thought we'd do something a little fun, and we're going to talk about some celebrities in Hollywood.
And the work they've had done?
Exactly.
Good, bad,
well,
or what we think
or what we
think they've had done.
Well, trust me, you're probably right. Okay, let's see who we've got up first.
So Renee Zellweger, you know, this was obviously a really big, I shouldn't even call it a scandal, but this was definitely something that was talked about in all the headlines.
Because she doesn't even look like
she
Renee
doesn't
anymore.
look like herself,
Well,
exactly.
prior she had something called ptosis. So ptosis is actually where the whole eyelid droops itself. So you can see when they take a picture of her eye, you don't see where the flash comes off, while afterwards you see it. So that's ptosis.
Would you say that's a brow lift?
So, no.
Or an upper?
See, this is the problem. She had upper eyelids done. If they would have lifted her brow just a few millimeters, it would have looked much better.
Uh-huh.
The problem now is she has her eyelashes and eyebrows sitting together.
You're right.
And that's not a nice look for a woman.
No, it's not.
In a gentleman, it's okay. In a gentleman, we accept the eyelashes and the eyebrows sitting together. But on a lovely lady, we want to see distance between the brow and
You want to have room
lashes.
to put on your eyeshadow and your contouring, you know, in the crease. You can't even see the crease. So
Her eyes come out. They look beautiful as far as her eyes. We see that nice blue color to them. But she doesn't necessarily look better. And it's a shame because she's such a beautiful woman. And if they just raised her brow just a few millimeters, and that still could be done for her.
let me ask you a question, just looking at it, you know, an inexperienced eye. Does it look like she had something done to her cheeks? They look a lot rounder. See how they are to the left, and then they look like little apples round. Do you think she might have had cheek implants or anything?
So if you look, there's a few things. Number one, in the first picture, she's smiling. In the second picture, she's kind of grimacing a little bit of a grin. And so that changes the cheek height as well. But the apple of her cheek sits in a different point. So in the first picture, the highest point of her cheek is right in the center. In the second point, the high point of her cheek is low down. If she did have filler, and if she did have an implant, it was not done well.
Not put in the right place.
Correct, because she looks older. Old people, more mature people, their cheek falls. The height of the cheek should be in the area over here, not down over here. And so if she had it done, that was a mistake. Now, it still can be corrected.
It also looks like she had some filler in those nasolabial folds. Doesn't it look a little bit smoother?
It does look smoother within that area itself. And again, if she had the implant in the cheek, that can also hide that nasolabial fold as well. So do her eyes look nice? Yeah, because you can see the blue color. But is it something that I would recommend as a procedure? No, would not.
It changed her entire face,
It changed
though.
everything
You
about
would not
her.
know that's the same woman,
Exactly.
in my opinion.
But we can still turn back time for her.
We'll have to tell her to get out here right now.
Absolutely.
Okay, who do we have next?
So Rose McGowan, this is by far one of the most interesting cases. She is one of the most beautiful women in this photo. This is her from the early 2000s. She was on her hit show Charmed when she really made her appearance into pop culture. In the early 2000s, she actually said that she was in a car accident and had reconstructive surgery, and it dramatically altered her appearance. So if we go ahead and take a look at the next slide, we can see her today. And a lot has changed, and it's not just so much, cheeks and eyes, but it looks like she's actually sort of kind of lost fill in the lips as well. A lot has changed about her appearance.
So yeah, her lips, in the first picture, she has a youthful lip, but it's doubtful that that was her natural lip.
Yeah, it looks...
Because it's too large on the upper lip compared to the lower lip. And there's a sign of beauty, a ratio of beauty, which says basically the upper lip should be 1 to 1.6 of the lower lip. And the upper lip is a little bit large, so I think she did have filler in that picture. But in the second picture, if she had fill, it's gone at that point. And if she likes that's fine.
Before we leave, because we're kind of winding down here, I have to ask if you think that her eyelids in the second picture need to be lifted up.
So she now has the skin touching the eyelashes.
Exactly.
And so, yes, we can use a laser. I can use a laser to customize and contour the excess skin and some of the fullness to the upper eye. We don't want to remove all of that skin. I still want her to close her eyes, and I don't want to remove all the fat because I don't want her to have sunken up her eyes.
And not to be picky, but before we leave, look at her hairline. Do you think that she might possibly be losing a teeny bit over there in the corners?
So she is, and centrally she is as well. And so if she likes sporting that hair, that's fine, but it shows that recession for her.
She needs you. She needs Dr. Berkowitz big time. So if you're watching, Rose, give us a call. In the meantime, we'll be back next week. We've got so much more to tell you about. And Rose, call us.